Hello, my name is Manal Isa, and I'm going to be conducting an interview with Dr. Bilal Nazif. He is currently a resident at Doctors Hospital at Renaissance in McAllen, Texas. Hi, Bilal.
Hi,
Um,
everyone.
I want to get your opinion on medical ethics. So I was going to ask you a few questions.
Okay.
Okay, so first question, tell us about your professional experience, your background as a doctor, your education and experience.
So, let's start with, I guess, my path on becoming a doctor. I went to a high school that was sort of a magnet school that was focused towards medicine. And that's kind of where I first really grew interest in medicine. Um, and then I went for college, did my undergraduate in biology, and a minor in chemistry, and then I went to medical school in Colorado, uh, and I applied for residency, and I ended up back home in McAllen, where I'm doing my first year of internal medicine residency.
First year, yeah.
Yeah.
And what is your specialty or expertise?
Well, I'm an intern,
Yeah.
so I don't really have a
Or what do you hope
specialty
to
just yet.
have your specialty be?
Well, I'd like to go into cardiology. Um, yeah, that's open. That's up in the air. I could change at any moment because I'm getting to experience a lot of different specialties while I'm here in my intern year. Um, but cardiology is what interests me the most so far.
What drew you into cardiology?
Well, a few things. So I did well, I guess first of all, my first couple of years in med school is where you kind of learn the systems, system by system. You go with like cardiology, pulmonology, things like that. And it seems like cardiology was the the field that I kind of just understood. It clicked with me. And then in my third year of medical school, I did a rotation in cardiology with a group over there in Colorado, and maybe it's true what they say that if you have a good teacher in something, then you might end up going that
Kind of
route.
fall for it, yeah.
That is what happened. I had a really great mentor for those 4 weeks, and he really cared about teaching. He cared about his patients. He would teach his patients. He would actually sit there and spend time with them and teach them what's going on,
Yeah.
rather than just tell them. So I thought that was great, and so it was a little bit of both. I like the field itself, I like the system, but then I had a really great teacher, a really great experience. So that's kind of where I ended up.
Okay, that's great. So you kind of like led into the segue on your own because my next question is going to be kind of about how the interaction with patients is. So can you tell me how you go about establishing relationships with your patients and how important that is to you?
Yeah, it's so with every patient, I try to do it. It's kind of like medicine in general. You have to be systematic. You have to uh, get into a habit of doing things, so that you don't miss anything. And probably the most important part is how you enter a room. So I always make sure to knock. And when I go in, you go in with a smile, a genuine smile. You greet the patient who's in there and anyone else who's in there, their spouse, family members, friends. I shake their hands and I introduce myself fully. I tell them who I am and that I'm a resident. And then I make sure that they are the patient that I'm supposed to be seeing. And that in itself, it doesn't take much time, but I think it means a lot to a patient.
It's very important, like the first.
Yeah, just that first impression. And just showing that like you're recognizing they're there, and then their family members too. They feel more comfortable with that. So I've gotten into that habit, and then you just sit down with them, and you listen. You listen, and you don't try to rush them. You don't try to like cut them off or anything like that. You just listen to what's going on with them and why they came to see you. And really it is a privilege for the doctor that the patient's coming to see you rather than to see somebody else. So a doctor should take that very seriously. So yeah, it's basically respect and recognition that I start off with, and then you make the scene comfortable. You can, depending on the situation, you kind of adapt, and you can sometimes
each one
joke.
is unique, depending on who you talk to.
You can joke with them. You can be lighthearted. You can be emotional. Every patient is different. Every person is different.
What are some of the barriers you face in establishing relationships with the patients?
Well, I think just this past week actually, I did have a patient that I had trouble with, and it wasn't so much that that I couldn't connect with them, but I feel like there was something wrong with that patient that nobody could really connect with. You know what I mean? They just weren't happy to be where they were, and which is understandable for any patient. But they were giving a hard time to the nurses, even the people who came in to give them food during the lunch hours or the dinner hours. So there are people like that, just in general, not necessarily in the hospital. There are people like that you'll run across in your life, and you can't change the way you interact with them just because they're like that. There is a reason that they're acting that way, but you have to stick to that set,
your professionalism,
your professionalism, that protocol, that habit that you've built into, and you just continue to be polite, and regardless of what they say, because I'll be honest, she said some things to me and to the nurses, and I was and I was sitting there right outside the patient's room, and I've seen everything that's happening, and everybody was being as nice as they can. Everybody was being very professional with her.
Yeah.
But that's the only barrier that I've ever encountered. For the most part, patients they've been great. With the way I've interacted with them, that's how they react the same way to me. So that's only the one case that I've had so far, and it just recently happened, which is why it's so fresh in my mind. It's just when somebody's not really happy.
Sometimes pain plays a role too.
Yeah.
So I guess that kind of answers also the question, do you have any advice for future doctors or healthcare professionals on creating a healthy, trusting relationship? And you kind of like went in with that